16 Things You Didn't Know About Depression. Depression is a mental health condition that causes feelings of intense sadness and hopelessness. Some people lose interest in activities they once enjoyed, while others feel so weighed down by it that even getting out of bed feels overwhelming. Depression can end up affecting your career, relationships, sleep, and even eating habits. Number 1. Symptoms of depression can show up in many ways. Depression is not a one-size-fits-all mental health disorder. The different types of depressive disorder includes major depressive disorder, persistent depressive disorder, premenstrual dysphoric disorder, postpartum depression, among others. Number 2. Major depression is one of the leading causes of disability worldwide. It affects around 264 million people globally, and about 7.1% of all US adults, and around 17% of adults in the UK. Number 3. Major depression can affect children, too. In children, signs of depression could include anxiety, irritability, a refusal to go to school, or frequent attempts to pretend to be sick. In teenagers, warning signs include frustration, anxiety, eating disorders, excessive sleepiness, and increased appetite. Number 4. Major depression is more common in females than in males. According to the National Institute of Mental Health, 9% of adult females in the US have experienced a major depressive episode compared to 5% of males, with very similar statistics in the UK. Number 5. It tends to affect people in early adulthood the most. Rates of depression are highest among adults between the ages of 18 to 25 years. Number 6. Depression affects people of different ethnicities differently. According to data from 2017, rates of depressive episodes were highest in adults who reported 2 or more races. Number 7. Depression affects LGBTQ+ people at higher rates than heterosexual people. In fact, it's estimated that LGBTQ+ individuals are twice more likely to experience depression, anxiety, and a higher risk of suicidal behavior. Number 8. The pandemic has led to a rise in depression rates. During the pandemic, data shows a significant rise of mental health condition cases, documenting signs of depression and anxiety and thoughts of suicide in comparison to data available for the period pre-pandemic. Number 9. Major depression often goes underdiagnosed and untreated. This is especially true among minority populations. A recent study found it to be, in part, because these populations are less likely to report symptoms to their healthcare professionals, and also because many healthcare teams don't recognize the signs as well as they should. Number 10. Depression causes different symptoms in different people. Someone who is depressed may experience any number of the following symptoms for at least 2 weeks: persistent feelings of sadness and hopelessness, lack of interest in activities once enjoyed, increased anxiety, among others. Number 11. In middle-aged people and older adults, depression is likely to occur alongside other serious illnesses. These illnesses can include diabetes, cancer, heart disease, and Parkinson's disease. Number 12. In adults, depression raises the risk of physical illnesses, too. For example, adults with depression have a 64% higher chance of developing coronary artery disease. Number 13. Doctors still don't know exactly what causes depression. Research suggests that it could have to do with brain structure or biochemistry. It's also more likely if you have certain risk factors, including having a family history of depression, experiencing different forms of trauma, or having certain illnesses. Number 14. Depression can increase your chances of drinking or using substances. Statistics show that around 20% of people with a mental health condition, such as depression, also have an alcohol or other substance disorder. Number 15. You can reduce your feelings of depression with certain lifestyle changes. According to research, beneficial changes include healthy eating, regular physical exercise, and getting enough sleep. Number 16. With proper diagnosis, depression is highly treatable. The sooner it is diagnosed, the more effective treatment can be. An effective treatment will vary from person to person and usually involves a mix of treatments.